Ankylosing spondylitis is unfortunately a diagnosis that's really typically delayed, and that's a shame. Late diagnosis is a problem. Apart from a patient not knowing what the problem is and having been subjected to years of potentially unnecessary suffering and pain, they typically have also wasted a lot of resources. When we see patients with late diagnosis, they've typically seen multiple allied health professionals. Those might be chiropractors, osteopaths, physiotherapists. They've often seen a number of doctors as well. So late diagnosis is wasted time, time to help the patient. In addition, the longer inflammation goes on, the longer it's unchecked, the more chronic damage it causes. In a disease like ankylosing spondylitis, the inflammation of the ligaments and tendons lead to stiffening of the spine. It leads to parts which should be flexible and pliable becoming bony and stiff. Once ankylosis occurs, that is the stiffening of ligaments and tendons into bony structures, that's irreversible. So that's damage that, despite the very best medications, we cannot actually reverse. So the hope would be that with earlier diagnosis, we can actually institute management that prevents this from happening. When you suspect a patient as having inflammatory back pain, and specifically of having ankylosing spondylitis, the first test one would normally do would be an X-ray of the sacroiliac joints. This is a useful test. If there's damage seen at the sacroiliac joints, the diagnosis is made. It's important, however, to realize that X-rays of the sacroiliac joints are really quite a difficult X-ray to interpret, and there's often variation in the reports. So sometimes we need to either have a high index of suspicion and then move on to a different investigation such as an MRI, or sometimes we need to get the X-rays re-looked at by a different set of eyes. The GP has a crucial role in managing patients with ankylosing spondylitis. Initially, it's to try to help get to the diagnosis. Secondly, often patients require referral to a rheumatologist because it's quite a specialized diagnosis. Invariably, treatment revolves around the use of anti-inflammatory medications and the institution of an appropriate exercise program. This is where GPs can definitely help. Lifestyle measures are critical in this disease. People need to keep active, they need to keep their body weight low, they need to be monitored for possible side effects of chronic use of anti-inflammatory medications. GPs can help encourage all this and help support patients through what is a chronic illness. Ankylosing spondylitis, being a relatively rare disease, does require a degree of specialist treatment. So I think early on it's worth involving a rheumatologist in the care of your patient. Later on, if a patient does not respond to anti-inflammatory medications and appropriate lifestyle measures, including exercise, there are other options for therapy. These are mainly in the form of medications called TNF inhibitors. The use of these medications is restricted to prescription by rheumatologists. So this is again another instance where involvement of a rheumatologist is useful.